Assalamu alaikum. Today we are going to discuss about the minimal change disease. As in the previous video we have discussed that how a normal glomerulus looks like. So we are starting mainly here glomerulonephritis, that means inflammation of the glomerulus, and mainly here in the glomerulus I have told you that in the glomerulus a filtration barrier is present, and in glomerulonephritis particularly inflammation of that filtration barrier takes place like this was that filtration barrier, and I have explained very much in the previous video. So let's start. I am again recalling it here that how a normal structure of glomerulus looks like in histological picture. Here you can see clearly that this is the capillary lumen in white color. Okay, this is the capillary lumen, and immediately outside the, like if this is the capillary lumen and this is the glomerular basement membrane. Okay, immediately outside that there are the podocytes present. So here they have highlighted that this is the podocyte, and if this is one capillary and this is an other capillary, then in between these two capillary loops filler cells or mesangial cells are present, and it is somewhat difficult to locate the mesangial cells like they have shown you here. So it is also difficult to locate or to spot filler cells or mesangial cells, but here they have shown you that this is the mesangial cell. Okay, so now let's move towards the minimal change disease. Okay, so in the case of the minimal change disease, as its name indicates that minimum change occurs over here, it is also called nil disease, or we also call it lipid nephrosis. Why we call it lipid nephrosis, I will tell you later. Okay, so minimal change disease, mainly its name indicates that it is characterized by the minimum changes in the glomeruli, and almost if we see by light microscopy that particular glomerulus will look normal under light microscopy. Then how we can detect the change? We can detect that particular change by the electron microscopy, right? We have to do electron microscopy in order to diagnose or detect the minimal change disease. And this particular type of disease, as in minimal change disease, C comes. So remember it that C, I mean, as C for children, okay, and C for change, minimal change disease. So this disease is particularly common in children of particularly 1 to 7 years of age. And the other thing that is most important and that comes in its scenario as well is that the patient recovers if the patient is given corticosteroids. As C for change, C for children, and C for corticosteroids. So common in children, minimal change disease is common in children, particularly ages 1 to 7 years. And again C for corticosteroids, that patient recovers in almost 90% of the cases, patient recovers if we give steroids. So this is your diagnostic point in your scenarios in your exam. So, and the what is its pathogenesis? Your medium Robbins says that its pathogenesis is unknown, but in your big Robbins it is written that sometimes it occurs after routine or prophylactic immunization, like you do immunization against any disease. It was just a prophylactic immunization and you got that disease. Or your big Robbins also says that it sometimes follows any respiratory infection, sometimes it follows venoms or stings, and say due to NSAIDs it may occur. And one more thing, one important thing, or it may be asked in your question, it has not been asked yet, so but it may be asked in your exam, that Hodgkin lymphoma is particularly associated with this minimal change disease. Okay, so let's come towards its morphology. Here you can see that this is the light microscopy picture, and in light microscopy picture, previously I have shown you the light microscopy picture of the normal glomerulus, and this is a light microscopic picture of minimal change disease. Here nothing can be appreciated, it almost looks normal. Okay, it almost looks normal. And so this is minimal change disease. If any picture comes in your exam and they ask you that tell the pathology, tell the disease, then it is a minimal change disease, though it looks like a normal structure. Okay, but in the case of the electron microscopy, if you have watched my previous video, it will be easy to appreciate you hear any abnormality. This is again the capillary lumen, okay, as mentioned by CL, this is the capillary lumen. And here you can see that this is the basement membrane. I'm highlighting that this is your basement membrane. I'm highlighting here the filtration barrier mainly. And immediately outside this basement membrane are your podocytes. This is your podocyte. This is your podocytes. Okay. And as the arrowhead shows that there is any abnormality, here is any abnormality. So this particular side shows that there is effacement or detachment of the food processes has been occurred at these points. Okay. So your in your morphology just write that in light microscopy no changes are seen, or the glomerulus just looks like a normal glomerulus. On number 2, write electron microscopy. In electron microscopy there is diffuse effacement or detachment of the food processes of the podocytes. Okay. And as it has been detached from this basement membrane, so the arcade between the podocytes and the glomerular basement membrane will be obviously obliterated, as they have not retained, as they have not any connection now. So the network of arcade between the podocyte and the glomerular basement membrane is also obliterated. And the other thing here is that, like you can see in this picture, that here the podocytes have formed some microvilli. Here are the microvilli formed, and here is the vacuolization. Okay, vacuolization of the podocytes have also been occurred. Normally this vacuolization is not present. So here microvillus formation, podocytes form microvilli, podocytes undergo vacuolization. So these are also the changes that you can appreciate by the electron microscopy. Okay. One more thing, that why it is called lipid nephrosis, because just try to understand it carefully, that in the case of the, as this is a glomerulopathy, there is an abnormality of the glomerulus. So in this case, glomerular basement membrane, that is particularly shown in that dark blue color here, this glomerular basement membrane becomes more permeable for the lipoproteins. As the glomerular filtrate, it is formed by this glomerulus, has a large amount of the lipoproteins. Okay. This large amount of lipoprotein is normally not present in your urine. So when this filtrate comes in the proximal convoluted tubule, okay, proximal convoluted tubule will try to reabsorb these lipoproteins, and there will be the abundant of the lipoproteins present in the glomerulus, right? The cells of the proximal convoluted tubules are thereby heavily laden with protein droplets and lipids, because they undergo the reabsorption of the lipoproteins passing through the diseased glomeruli. So we call it as lipid nephrosis. And in clinical manifestations are almost all are similar to the nephrotic syndrome, in which in which hyperlipidemia occur, lipiduria occur, hypoalbuminemia occurs, and generalized edema also occur. And generalized edema is the most common clinical manifestation and the most obvious, or we must say that this is the most prominent clinical manifestation here. Okay, so that was all about minimal change disease. Thank you very much.